Hey everybody, it's Matt Shu from Upright Health, and today I want to talk about massage and what it means for back pain. Um, so I've got Josh Hash down here. Say hi, Josh.
What's up, everybody?
So Josh and I and his brother and a couple other friends went out to the beach this past weekend, and we got this really great idea while we were out there to have Josh's brother, who is even larger than Josh, um, try to throw me as far as possible. And maybe we'll put the video on here so you can watch it. But basically, I flew pretty far, and in the tumble, um, I kind of strained my back a little bit, and it wasn't feeling good the next day. So I went to go get a massage to see if that could help loosen up my back and just kind of help things feel a little bit more settled. And I got a pretty normal massage. It was pretty standard kind of fare, and I wanted to talk about it because um, it wasn't really that effective in helping. And I also, it reminded me of how many clients we've had come in say, oh, I've had tons of massage for my lower back, and it just never seems to really help, or it helps only momentarily, and then within an hour or two, my back problems have come right back. So what I wanted to talk about is, in general, with massage, um, the standard protocol with the kind of run-of-the-mill massage place is usually start with the calves, right? And you start working up. Maybe you get into the hamstrings, then you get up into the butt. Maybe they'll do long strokes, short strokes, things like that. But a ton of the time gets spent right here, all on the spinal erectors and a lot on the low back, where people complain the most about having issues. Now, here's the thing, Josh. You've had some back massage done before, right?
Yes.
Um, what did it really feel like for you when you had like 30 minutes of massage done on your back? Did it make any big changes for you? Did you notice anything when you did that?
No, I mean, it feels good, I guess, at the time, right? But you don't really notice anything after you leave.
Okay, and so that's actually what I've noticed for pretty much most of my life. I had back problems starting when I was 16, and I would get massages. They'd work here all on the lower back, work into the mid back, just trying to loosen these muscles up. Sometimes, you get an elbow deep in there, just grinding away, just trying to make these muscles release. But then when I got up, everything would come back. So there's a couple reasons, I think, a couple things that can be done to improve massage in general to actually help with more frequently help with lower back issues. So the number one thing is, if somebody's got a lower back problem, putting them in this position may not actually be the best thing. So if you're somebody who has a posterior pelvic tilt, you've had a lower back disc problem, going into this position might be helpful for you. But if you're somebody who has lower back discomfort because you have anterior tilt, look at the position you're in. So yeah, so Josh is kind of showing you what's going on, right? He's got a little more anterior tilt when he's in this position. So let's say you're a massage therapist, or you're somebody who's just a client. Grab some tools here. One of the ways you can actually make this a little bit more comfortable is to actually get something under here. So a pillow, a couple pillows, to try to get the lower back out of that really heavily arched position. So now you can see, now we've put that back into that decompressed position rather than putting it into that arched position. So for me this past weekend, my back was feeling really crappy in that anterior tilt position, and compressing it more was even worse. Lying there like that, it really took a lot of focus to actually fire my abs and keep my back in a more neutral position. Now, the other thing that I want to talk about is a lot of standard massage works all up in here, up into the mid back between the shoulder blades. Um, for most people that we run across, they're already really weak between the shoulder blades. So that sense of tension back there doesn't actually improve when you smash it and smash it and smash it. That tension there actually improves when you get these muscles stronger and you work on things like scapular retraction and things like that. Now, what you could work on to help improve some of that is actually on the other side, which is where I see a lot of, for me, I just feel pretty dissatisfied with a massage that doesn't really deal with the muscles of the front of the body. So there's kind of a theory that under stress, pretty much everything that puts us into the fetal position fires, and that seems to be more or less true. So that means we have to work on the muscles of the front of the shoulder, the chest, and even the front of the legs. But a lot of massage, you spend the huge majority of the time face down like this, only focusing in this narrow band. So if you can, what you want to try to do as a client or as a massage therapist is put some focus up on the front. So Josh, let me have you turn over, and if you're anybody who's doing any kind of tissue work on anybody, this is really important to think about. You can scoot on down this way. You don't have to have your head precariously balanced on that thing. There you go. So if we wanted to work on some things that might help even more, if it's somebody who's got anterior pelvic tilt, working the quads can be super, super helpful. In loosening up this tension, you allow that pelvis to tilt back into position. Another little trick that's very helpful if somebody's got some lower back issues. Let's say Josh has some tension in that left side of his lower back, and he has a lot of anterior tilt. What I might want to do is have him just bend one knee while I'm working on the quads. Actually, let's do this the other way so they can see it. So let's say he's got like right lower back discomfort. We could have him bend this knee, so that helps keep his pelvis more neutral, and then do massage work on his right quad to help release some of that tension that's pulling his pelvis into that position. And then if that seems to help, then we know, okay, your quads are contributing. We need to help you do a little bit of stretching, something like that. Do more tissue work on your quads to help level your pelvis or keep it in a more neutral position. And if it's somebody who's definitely an anterior tilt and you want to help them out, doing both sides will definitely be a good idea. And you position them so one leg is up, one leg is down while you're working. So what happens if Josh has both legs down? Go ahead and put that one down. Is he's going to have a tendency to have more rib flare. He's going to have more of that lower back curvature. So bending one knee then neutralizes that and helps him out, just like that. So also, if we're talking about that upper back tension or neck tension, having him face up and then working on the pecs, working on anterior delts, working on the front of the neck, working on his upper traps, that can all be done from a face-up position where you can just go ahead and, let me scoot on over here, you can just get in like this, right? And you can actually work just here, working all through that musculature instead of having them flip down with the shoulders rounded forward for an hour in a position that's really just going to encourage these muscles to shorten up and the muscles in the back to lengthen up, weaken, and possibly give you that sensation of tightness. Instead, we put them here. We have the opportunity to get the shoulders back, and then we can help loosen up some of the tension that might be playing into this shortened shoulders forward position. You can also get in on the biceps, which also help to correct that shoulder position and relax some of that like typist kind of position that we normally have from working all day at a computer. So we can work all through here as well. So those are a couple ideas that can help improve, I think, the general experience of massage and really get more at the root issues involved instead of working on just the point of where it feels like it hurts. That's really chasing after symptoms rather than understanding how to optimize the way the body moves and functions. If we look more at some of these muscles rather than just at the back, we can help somebody move a lot better and help resolve a lot of issues a lot quicker instead of just sort of grinding away at the same old symptomatic areas. So hopefully that gives you a couple of good ideas. Whether you're a massage therapist or you do any other kind of manual therapy, a couple ideas to help you help your clients and patients. And if you're somebody who's dealing with all this kind of tightness and back stuff, shoulder stuff, and leg, hip stuff, hopefully this gives you some ideas to talk and communicate about with your professional so you can get a little bit of a more effective session. So I hope that helps you out, and I hope you remember that pain sucks.
Life shouldn't.
Oh!